Hi, I'm Dr. Stefanidis. So a lot of people have difficulty taking eye drops, and there's a right and a wrong way to do it. And this video will teach you the right way to take eye drops and give some tips for people who have a hard time doing so. First, when should you take your eye drops? If you're supposed to take more drops than one type of a drop at the same time, separate them by 5 minutes or so. This lets the first drop absorb before it gets washed out by the second drop. Most eye drops come in bottles that have a screw-on cap. Once you unscrew it, you need to be careful not to touch anything to either side of the cap or inside of the cap because these areas are sterile. Any bacteria that gets on these surfaces can grow in the bottle and contaminate your drops. Some eye drops come in little vials like where you twist off the cap. These are usually drops that have no preservatives, and they're designed for you to take a single drop and then throw the entire vial away. Without preservatives, there's nothing to keep bacteria and fungi from growing inside your bottle, so the manufacturers make them for the single use. Throwing the vial away is what's recommended and approved by the FDA, but to save money, some people like to use these droppers more than once. If you're going to do that, here's what I would recommend. Keep the tip of the vial from touching anything and store the vial with the tip up inside a clean shot glass or other narrow container. Keep this in the refrigerator, which also minimizes, but not entirely, prevents contamination. Okay, here's how to take an eye drop. First, tilt your head back as far as possible. Sometimes laying down makes this the easiest. If you're right-handed, hold the eye drops in your right hand. Use your left hand to pull down your lower eyelid, which makes a pocket between your lower eyelid and your eyeball. This is where you're aiming for the drop to fall. Rest your right wrist on the knuckles of your left hand. This gives your right hand better control and stability. Between the thumb and the index finger of the right hand, hold the bottle an inch or more above the pocket in the lower eyelid. Don't let the dropper tip touch your skin, the eyeball, or the inside of the eyelid. Squeeze out one drop and let it fall into the pocket. You can do this same maneuver for your other eye. Putting the drop on the forehead or cheek doesn't count, but may happen when you're new to this procedure. If you miss, try again, and you'll find you can get pretty good at getting those eye drops in. If you absolutely can't do this, here's another way that's not quite as good, but almost anyone can do. Look up toward the ceiling, or lie flat if you prefer, and keep your eye gently closed. Let the drop fall in the little valley around the inside corner of the closed eyelid. Then open your eyes and blink a few times. The drop will roll right into your eye. This method is not quite as good because the drop comes in contact with your skin before going into the eye, giving an opportunity for skin bacteria to contaminate the eye drop. Though it's not ideal, this method is usually better than not taking any drops at all. By the way, there's never a reason to take any more than a single drop of any eye medicine. The eye doesn't hold more than one drop, so taking more than one drop is just wasting your medicine. Some people say they can't always feel when the drop goes into their eye. A good way to make this easier is to refrigerate your drop. You'll feel the cold on your eye. It's actually kind of soothing, and although it's not required to refrigerate most drops, it will not do any harm to keep them refrigerated. If you're taking drops that are stinging or irritating to the eye, it often helps reduce stinging a lot to keep the drops cold. I hope you find this information makes taking your eye drops easier. I'm Dr. Stefanidis. Thanks for watching.